I'm a trained anesthesiologist. I subspecialized in interventional pain medicine. So I found that some of the most gratifying experiences that I had was when I was helping patients manage their pain, whether that was in the surgical setting, on the labor and delivery ward, or most importantly in the chronic pain clinic. For our chronic pain patients, it's a big challenge to do something like walk down the street, to walk up a flight of stairs, to pick up their grandchild. So when a patient walks through our door, our evaluation starts with a comprehensive history and physical exam. We do that as well as a review of their diagnostic tests, any imaging studies that they may have had done. And using that information, first of all, we try to determine what is the underlying reason for why they're having so much pain, where is it localized, and what is it, again, preventing them from doing. Using that information, we make a multimodal, multifaceted treatment plan, and that ranges from neuropathic pain medications to comprehensive therapies to interventional pain procedures, which is where I specialize in, to help them, get to that higher level of functional capacity. So some of our patients are not eligible for some of the interventions or medications that a traditional patient might be able to receive. And so for these patients, our practice does a fair amount of peripheral and spinal cord stimulation. And what that means is actually implanting a device that actually shifts the way the brain interprets those pain signals. And it's a powerful therapy that actually helps our patients get over their pain and, again, achieve some form of functional recovery. I think the biggest reward that I feel is when I see a patient back in clinic. Maybe this is after we have tried a pain procedure, or we've sent them for some complementary therapies, or we've started a new medication, or something that we have done as an intervention. And they come back and they tell me, "Doc, I feel so much better." Outside of being in the hospital or in the clinic, I love spending time with my family. They're very dear to my heart, obviously. We spend a lot of time outdoors. We spend a lot of time doing things in nature. We also spend a lot of time traveling, especially to Europe, where my wife is from. And if we're not doing that, we're spending time in museums, aquariums, zoos, just anything to actually enrich the lives of, we have a 2-year-old son, so he's always interested in anything that has to do with nature or the outdoors.